And welcome back. I'm Mabel John. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. And a very special welcome to those of you who are joining us online. In our studio right now, Carl Schuessler, who is with Mitigate Partners, and it's great to check in with Carl. We spoke last year.
Yes, ma'am. How are you doing,
Carl?
I'm doing great, thank you.
How's the year been?
It's been great. Been great.
Been great for Mitigate Partners?
It has.
And tell me more about what your health plan does.
Sure. Mabel, I guess it was probably over the last 6 years, we were fortunate and blessed to meet a lot of good people like Brian Klepper and some of these folks that were involved with high performance healthcare solutions. And so what we did is we found and located them at all ends of the earth. We sort of brought them together, and the goal was to be the best fiduciary and steward of our clients' money, treat it like it was ours. So we brought all these together, and there's about 19 different solutions that we integrated in together into a health plan that is, obviously administered by a third-party administrator, a TPA.
And who are the members of the health plan?
The members?
Or who are the customers?
Oh, the customers or employers. And we don't have a lot of lives on the platform yet, but the health plan is built. What it's done, if you're familiar with how Blue Cross or United do things, they have a plan they sell you. What we've done is made a better version of that, and it's really employer-built healthcare, not insurance company-built healthcare, but with all of these great solutions that improve outcomes for employees and members and reduce cost.
And how do you do that?
We got to be smart, first off. No, I'm kidding. That was supposed to be funny. You have to, it took a lot, because you can't find people that can put all of this together, and you have all the different connectivity from technology. And so we were able to do it and make it seamless, so when employees use the plan, they're not really seeing the complication behind the scenes that is there. But it involves many different components. Okay,
so you've put together providers that will charge a fixed rate, or?
Correct.
Go ahead.
Yes, we've got, I'll just go over a couple of components. We've got a special RX optimization solution that reduced the prescription drug cost. We've got programs that manage chronic kidney disease, musculoskeletal. You've interviewed some of these people. Those types of solutions. And then we have the utilization management, disease management, and case management. That is very important, and it's an offensive weapon if designed right, to make sure when you find a member calls to have a pre-cert, or a provider calls in, that's when everyone starts to work on that with that member, not after the claim is paid. So it's very aggressive, and then you really have to weaponize your plan design, and that's what we were able to do. Our plan has no deductible. We believe the better the plan, the lower the cost. We want people to take care of themselves. We encourage them.
Okay, and how are employers, what's the reception right now?
It's been good so far. I mean, it's a challenge to walk into a CFO's office or an HR's office and imagine they have a bowl of fruit or a bowl of candy, and you're asking them to turn over that bowl of fruit and forget everything they've heard for 30 years. It is challenging, so you have to be artful on how you present it. They want things seamless and not a lot of disruption, so the way we built it is we feel it is very seamless.
You were also a part of a workshop. What were some of the things that were discussed there?
We were talking about how to manage the health supply chain, some of these types of solutions, and success we've had with clients and what the results were.
Okay, and what did you get out of that?
I knew one of the panelists, and I knew of the two others, so there were some great ideas shared. I learned a couple of things that were different that I hadn't heard, but for the most part, a lot of the things we discussed, many of us are familiar with.
And what hadn't you heard that you were able to?
There was a tool to do that one of the gentlemen shared, Tom, that would allow you to do some type of pre-hiring testing that was not in violation of EEOC, and there are a lot of things that can be caught from a potential new hire that you could address or avoid. So that was very interesting.
And any message that you're leaving with our viewers today?
I believe there's so much hope. There's so much that can be done. Don't sit and take what an advisor or people tell you. You can do this, and you could even save upwards of 60%.
Dramatic.
Yeah, I mean, it's a lot.
All right, Carl Schuessler, thank you so
All
much.
right, thank you
Great
for your time.
stopping
Thank you.
by. And thank you for watching. Stay tuned. We have many more interviews coming down.